pleased to be in Pakistan and pleased to see this idea of bringing more control on the medication available in the country through this system of track and trace. I know that many countries, they are a little bit hesitating to implement due to the limitation of resources. However, taking into account the benefit of having these systems in place, I think it brings a very good impact for the country. First of all, just to control the supply chain and minimizing the risk of substandard medication or falsified medication entering the in illegal ways. This is one of the very good tools that control this issue and minimizing the risk. Other very important is to saving the resources for the country like Pakistan with limited resources by controlling all the medication going through public tenders to stores, to pharmacies, and to patients. A very good example about this with the Saudi, they were announcing that through track and trace implementation across the kingdom, they were able to minimize the quantities needed for the tender by 30%. So best wishes in the implementation. I do believe that this is a very great initiative to take forward. Thank you.
Zakyia, these are from public...
So we are from the ministry. I'm from the Ministry of Finances, Ministry of Planning.
Nice
But
meeting
we are ex-pharmaceutical.
Yes.
We are both medical doctors.
Okay.
So tell me what you were telling me about when Saudi implemented track and trace.
Yes.
How much their public spending?
Well, in Saudi, there is a very big tender which called Nobico. That tender brings very big quantity to Saudi to cover all the requirements for the people insured. And health insurance in Saudi cover most of their citizens. So with the track and trace, because they were able to track each single box to the last store, to the last patient, they were...
Last store as well as to the patient.
Exactly, to the patient, to the last patient. They were able to minimize the quantity of Nobico by 30%. They were saving 30%, which was like a waste. Things were lost during the supply chain. Yes, exactly.
Even when there is no corruption.
Yeah. So, exactly, even with because
it was like obsolescence management, they got expired.
Someone forgot those samples in the store at that corner on that shelf, something like that. And Saudi is so much big, and there is so much rural areas. So there was a saving of 30% from the tender quantity by just controlling the products over the cycle from the supplier till the patient.
I have the knowledge of how big a problem is that for the Pakistani health management.
Much bigger.
Much bigger?
Counterfeiting.
Yeah. Counterfeiting is an issue.
Counterfeiting is an issue.
And counterfeiting is something else because
supply chain is an issue.
Africa, for example, now they are enforcing track and trace to minimize the falsified medication, because this is the only way to make.
In Africa?
Most of the countries, Kenya, Nigeria, Egypt, North Africa, now they are implementing Tunisia. So South Africa, I think many countries within Africa either implemented or in the process to implement to minimize the risk of falsified medication.
Who was the vendor who did it for Saudi Arabia?
सऊदी एफडीए ने डिप्लॉय किया था, उन्होंने ओपन टेंडर किया था, टर्किश एमएच ने जीता था। टर्किश एमएच का एक सप्लायर है, उसने जीता।
It was a few years back. Saudi was the first country in the region after Turkey to implement track and trace. But if you're interested, we can bring those. But
I know that.
Just take some Google.
Yes.